Hey everyone, Dr. Derek Gatta, one of the co-founders here at Risewell. Excited to have you today. We're going to be having a great in-depth conversation with Dr. Spencer DeSanti out of Calgary, Canada. So, Doc, if you're out there, I'm going to go ahead and invite you on to join. So, hope everyone's having a great day out there. So, Doc, there he is. Doc, welcome to the program. Can you hear me okay? Well, we had him for a moment. Let's try it again. All right. Invitation sent. So Doc is a holistic dentist. Hey, there he is.
Are we connected? Can you hear me?
Hey, can hear you great. How are you?
All right, good. Let me turn up the volume here and get going. I'm good. How are you?
Hey, wonderful. Excited to have you today and diving into all things holistic wellness and that type of dentistry.
Yeah, of course.
So I'm curious. Tell me about your journey to dentistry and your background, a little bit about yourself.
Uh, well, I'm practicing up here in Calgary, Alberta, and been practicing up here, almost 9 years, I think. So I went to school down in Chicago at Midwestern.
Okay.
And I grew up in the States originally. So I'm originally from Washington State, California area. And my dad would kind of moved around a little bit. But after dental school, my wife, she's from here in Canada and Calgary, and she was itching to come back. And I said, "Do I have a choice?" And she said, "No, that's where I want to go." So that's where we've been in the past while here, and it's been great. My intro into dentistry, I've always kind of wanted to be a dentist, through school and high school. Whenever you did your career research projects,
Yeah.
I was always dentistry or orthodontics or something of the like. So I always had kind of a keen interest on that, and it just the cards aligned. The dominoes fell in the right place, and I kept pursuing it, and I didn't get grossed out by the blood or the nature of being a dentist, and never turned me away, and worked out. So it, I guess, aligned, and I never steered in another direction. So
That's great.
Worked out pretty good for me.
That's great. No, I love that background. Thank you for sharing. And I'm also curious that there are many different labels that dentists can have nowadays. I mean, there's cosmetic dentist, there's orthodontist, holistic dentist, biologic dentist. I mean, did one of these terms kind of resonate with you? And how do you kind of classify yourself and your treatment style?
Yeah, well, to start, holistic dentistry, biological dentistry, functional dentistry, all kind of the same name, just different ways to coin it.
Yeah.
But it's not a specialty of any sorts. There's no official training program that you can go and become a holistic dentist, but it's more of a philosophy and a theory. That kind of started with me. Well, my wife was actually kind of the instigator with that. She had a few health concerns and wasn't finding solutions or answers with traditional medicine, and started looking into alternative ways. And that's where she found that she healed. So through dental school, she kind of had the idea, there's something out there that's more natural, holistic based, and they definitely don't use fluoride or promote fluoride. I want you to kind of look into that. And during the dental school days, you're like, okay, sure, maybe, but you're in the middle of the education, right?
Yeah.
So in the normal dental world, fluoride's the kind of end all be all sort of option, and it's becoming more studied and researched. And as you guys are well aware, and our clients and patients alike are well aware, that there's concerns coming out about it. There's studies, there's lawsuits, there's class action lawsuits that start to paint a picture of an alternative or argument against fluoride. So that was kind of always in the back of my mind as I was going through studies, and opportunity arose a couple years later to join a practice like this, and where we have the when we say holistic, the way I think of it is how the whole body's connected. And as dentists, we shouldn't just treat the mouth separately and fix, kind of be a tooth mechanic and just fix what we see. But it really should be, why is this happening? What's the root cause? Why are you constantly getting cavities or your tooth breaking? How's that related to the whole body? So it's more of a deep dive. And so that's kind of where Risewell comes into the picture too, because of how hydroxyapatite can help heal a tooth naturally and strengthen the tooth. It's funny, I'm sure you don't remember, but I think we met one time at a IAOMT conference. And
All right.
it was probably, I don't know, in Colorado or Boston. So it was years ago.
Oh, wonderful.
I don't know. I know you guys still have a booth going out there, but that's general, like an association for the dentist that practices this philosophy, where we gather, can learn about cool products and things like that. So yeah, it's funny. I kind of was like looking, and I was like, I think I probably met him first. It must have been when you guys were getting started, or what?
Yeah, so Boston 2019, I believe, was our first IOMT conference, and just kind of testing the waters. And so I feel kind of gypped on my dental school education. Look, it was wonderful and great in a lot of ways. They're tasked with producing safe, competent dentists, and it's only a 4-year program, so maybe the curriculum's not big enough to dive deeper into all these topics, especially if they potentially haven't been around so long. But my sister's been very open about some of her fertility challenges with polycystic ovarian syndrome, and that was kind of the deep dive for us to examine. Her physician was saying, you really need to, you're going to be spending a ton of money on IVF, right? So let's increase your chance of success by as much as possible. So you need to start eating better. How about that? So, her and her husband ran home. They're able to clean out the cupboards and refrigerator and start eating more whole foods, less ultra processed foods. Then they started examining their beauty products, lotions, potions, things that go on your skin, in your mouth, oral care products. And they connected with me because I was practicing down here in South Florida. I had just left the Navy and was down here. And a lot of my patients down here are super high dental IQ, very focused on natural type remedies and less detergents and chemicals in their products. And honestly, I was kind of tired of arguing with people about fluoride. Yes, we know it works, but you know what? Amalgam fillings work too, but no one really wants those anymore. There are better options out there for people, and we kind of combined forces. Discovered through some research that hydroxyapatite's been used in other countries like Japan for decades with a wonderful track record of efficacy and safety. Now it's kind of our deep dive into this space.
It's a slippery slope, Derek.
Yeah,
once you open the door, there's no turning back.
Yeah. I was holistic curious at first, and now I'm getting deeper and deeper in, and just it's great to just expand your mind and look at the other options that are out there for people.
Yeah. So did you find that there was just a lack of this type of product in the market? So that was your kind of boost into that creating Risewell?
Absolutely. And for whatever reason, there really wasn't a market presence here in the U.S. from the big box companies. And we were looking to give people more choice in the marketplace. And it's funny. I hate to think that people consider that word alternative medicine or alternative dentistry, because I feel like it kind of diminishes what we have to offer in terms of the benefits, the efficacy, the safety profile. I would say that the research behind hydroxyapatite is making a strong argument for the mainstay product versus fluoride in itself, not just an alternative, but becoming the mainstay ingredient for remineralization and sensitivity relief. So I kind of push back when I hear that label alternative.
Yeah, well, I say often that fluoride is a replacement for hydroxyapatite.
I love that.
Because we already have hydroxyapatite in our body, right? Our bones and teeth are made out of it. So technically, fluoride's a replacement for that.
That's a great point.
So let's just use the natural stuff, right?
I love that.
Yeah, And I believe, this, you touched on, the alternative phrase, and I 100% agree. Like, I feel like this is the way dentistry should be practiced. This shouldn't even be an alternative. It should be taught in dental school. You got to do a deep dive, and you got to look into the source of why things are happening. And we're really kind of doing a disservice to our profession by not doing that, by not taking a root cause systemic health approach. And so I think the trend's going that way. More so the demand with clients and patients alike are leaning that way. So that's probably going to push the trend of the professionals, I think. But it's moving in that direction. Hydroxyapatite is a big part of it. Like you said, it's been in Japan for years. Wasn't it created by, or the alternative form created by NASA?
Yeah, it's a great point. So initially, yeah, I mean, they were looking for remedies to help astronauts in a zero gravity environment when they were losing bone mass, bone density, minerals in their teeth, and also an option to swallow a toothpaste successfully if you're trying to brush in space and you can't spit things out in a sink like normal here on Earth. And yeah, for whatever reason, that technology did not gain traction here in the U.S., and the Japanese picked up on it and took those ideas and successfully were able to classify hydroxyapatite as an anti-caries agent in their country, and something a label we still don't have here from the U.S. But I think the tides are turning, especially here domestically with Kennedy as the new HHS head, looking to continue the push for other options for patients in addition to fluoride, such as hydroxyapatite. And I think we're gaining momentum, and it's just an exciting time for folks.
Yeah, I think so too. It's fun working with the clients we have because they are very well educated. They have lots of questions on a wide range of topics. But one that's come up recently is just a question about nano versus micro or macro. Some concerns, I think, going around the internet that nano can have negative impacts on the body. With you being, deep into the research and the know-abouts, what do you say to that question?
Look, it's a great concern, and we want to provide confidence for everyone out there using hydroxyapatite-based products here. And some of the research coming out of Koyama's group is looking at how nanohydroxyapatite gets caught in the stratus corneum of the oral mucosa, and that skin layer dies within about 5 to 7 days and is constantly turned over and replenished. And so that's usually when those nanohydroxyapatite particles would be discarded and brushed away here. So they didn't find evidence of that leaching into different parts of the body. Also, at Risebone, we started as a micro hydroxyapatite based company back in 2019 when we launched. It wasn't until the European Union's 8-year-long safety study on nanoparticles came out, giving us confidence in the industry that nanohydroxyapatite was a great, effective, and safe for sensitivity relief and remineralization. Their 8-year study looked at the specific concentration and the molecule size of hydroxyapatite. So up to 10% concentrations of the nanohydroxyapatite and the rod-shaped particle. It comes in different shapes. There's needle shape and rod shape. Rod shape was the one that you want to be using, and you want to talk to your supplier about where they source their HA from as well, because we're using Fluidinova in Europe, and that's where the 8-year safety study was conducted and gave us confidence to move forward at the nano level.
Yeah, that's what I was kind of familiar to. So that's kind of the answer I've been giving. Hey, as always, quality matters, right? Where it's sourced matters.
Sure.
What do you notice? So the benefit, because you have both a version of that has micro and nano, or one that has a hybrid of both, right?
Yeah, our traditional line is micro, and our professional line is nano. So we give people options and choice, and that's been working well for us. And I'm curious, when new patients come to your office, what's I know we've been speaking a lot about your approach and how you interact with patients at the holistic level. But hypothetically, I'm a new patient to your practice. Run me through your protocol. Like, how do I get entered, and what can I expect as a new patient at your office in Calgary?
Yeah. Well, my favorite compliment, or I take it as a compliment, my favorite comment is when a patient comes in and says, wow, I've never had a dental experience like this, where the dentist just sits down, talks to me, and doesn't look at me like I got three different sets of eyes, right? And so I take that as a compliment because, you know, they had a different experience, and it's going to resonate and stand out to them. And really, I mean, there's no magic pudding or magic sauce or anything. It's just sitting down, listening to the patient, hearing what they have to say, not making them feel like their ideas are crazy. I like to really sit down and just have a face-to-face conversation and easily spend 20-25 minutes just talking, and I have their medical history in front of me. They're just like, oh, well, tell me about this. So you said you have digestive concerns. What's going on there?
Yeah.
They go into it, and then it's like, well, the mouth has a direct link. They're on the opposite ends of the track. So if you have disharmony in the gut, you're going to have disharmony in the mouth. And to heal one, we got to work on both. So that's one option. We go in medical history, you got snoring, sleep apnea concerns. Okay, what's going on there? That can be linked to cavities and imbalance in the microbiome, etc. And so that just sits down and keeps the stress, the tensions low, allows us to really see the whole picture of their health and see what we can do to focus on the mouth. And I'm really, in Calgary, we've built a really good team of external resources. So we work a lot with naturopaths, homeopaths, chiropractors, functional medicine docs, nutritionists, whoever, that things that are outside of my scope, I could say, well, you need to go talk to this person because they can help you with this, and what we're doing here, it's going to work together. So it's more of a holistic approach in that regard, where dentistry is often the starting place. Health starts in the mouth a lot of times, but I need the help of other practitioners that have expertise to help the patient accomplish their goals. So we really, really, really believe in empowered healthcare. So it's not my job to tell you what to do. It's my job to be your coach and be your guide and be on the journey with you. And so if I can help point you in the right direction, if I can give you the pros and cons of all different options, then I'll be there right next to you to guide you and support you in the decisions you make. So we may have, you know, some red flags or hot topics in the dental world are fluoride, as we're talking about. Root canals can be a hot topic. Amalgam fillings, due to the fact that they have mercury in them. Those are hot topics. So we're never telling anyone that, hey, you got to do this because it's bad. But it's like, here's the pros and cons. What, you know, if everything is all good, then you want to watch it, let's watch it. But if you're concerned about it, then let's address it in an appropriate, safe, healthy way. So I think that's where patients find a difference.
I love that. You bring up a lot of good points there. And, you know, really is dentists, we're on the front lines of healthcare. I mean, patients probably see us more often than they see their primary care physician. So we're really at a great junction to intervene, not only checking blood pressure, but just looking at the patient's overall health. And a lot of patients are kind of surprised, like, gee, doc, why are you talking about my nutrition or what I'm eating? Just like fix my teeth. But I just gotta kind of educate them that, yeah, we're going to fix your teeth, but there are systemic connections that link your mouth to the rest of the body. Is the patient overweight? Are they consuming ultra processed foods? A lot of it links back to nutrition. I mean, just trying to keep refined carbohydrates and sugar off the teeth so the bacteria can't create the acids that lead to decay. So I have extensive conversations about nutrition because it's a very easy disease to break the cycle of. It's very preventable. And I think patients, they don't give themselves enough credit or take enough responsibility, because a lot of times people may push back and say, oh, it's my genetics, or I have soft enamel, or I was just born this way. But I really try and give them confidence that you can take power to have sovereignty over your own oral health and change the course of your path right now.
Yeah, 100%. I mean, genetics may have a small part, but more often than not, it's environmental factors. The mouth, if you look at it the right way, can be a roadmap to the rest of your body. I'm no expert in Chinese medicine, but there's Chinese meridians that that are attached directly to the mouth and flow to the different organs of the body, and that can be, if not none else, a resource to say, hey, let's at least check this and see what's going on, and honor this pathway and see if there's any sort of connection, right?
100%.
The more information, the better. And I think that's a great way that's been used for thousands of years for health. So yeah, our approaches are the same. It sounds like we work pretty similar, and it's shocking that patients feel this is such a novelty in the dental world, which it shouldn't. Like you said, we're the frontline providers, and if we're doing our job right, we can be also directors to the doctors and the physicians and whichever else, and say, hey, you ought to go check this out because it's concerning here. So I think there needs to be better harmony in that aspect between dentists and the rest of the medical world.
Absolutely. I'm advocating for change, and yeah, it sounds like you're on the same thought line. I'm curious. When I was kind of researching you a little bit, I was looking at some of your websites and your work out there, and you use the term biologics and services that you offer, and I'm curious, how can we help explain what that means to the listener, and you know, what entails when you use those terms and what services you offer to help heal folks?
Well, it's all based on the fact that we want to use the best materials that are available for fixing teeth or for restoring any condition in the mouth. Now, keywords is what's available, the best that's available, because there are limitations. But patients that are really keen on knowing, okay, what's good for my body, what's not good for my body, there's ways to test different materials. Specifically, there's blood tests that can draw blood, send it to a lab, and the lab has a whole list of dental materials, but they narrow it down specifically to the materials we use in our office, that we can test if the patient would be suitable for that or not suitable. So often we find patients, even it's brand specific. For example, a cement. One cement might be okay for a patient for whatever reason, but another one might not be okay. And so that just gives us more information, the better. Then we can say, okay, we know this type of crown material, this porcelain is good for you. This type of cement's good for you. So let's use the ones that are testing as suitable product specifically to you, and make sure we're not creating any poor reactions or allergic reactions or any negative response from the body. So that's kind of where biologics come. Again, we're trying to use more natural products, so that's where hydroxyapatite comes in. We're trying to use, we use a lot of PRF, so that's platelet-rich fibrin, which is, again, from the patient themselves. I'm sure you're familiar with that, maybe even use it yourself. But it's basically just a blood draw. We can use all the healing factors and the blood cells and all the positive things to heal a bone extraction area, and in a natural way. We're not using anything foreign in that regard, but getting great healing results. So I recently saw something, and it's very intriguing to me. So I don't even know if it's legit or not, but I want to look into it. But I saw people, or a doctor had used extracted tooth and ground it up, and then used that as the bone matrix with PRF in the extraction area. And to me, that's like, well, that's genius, because you're still using the own body and using healthy cells and to heal the area rather than a foreign bone graft material.
Yeah, very, very intriguing. I mean, if it's a healthy tooth and doesn't have a diseased tooth, it sounds like an interesting idea for sure.
Yeah. I'd love to learn more about that. So if you know anyone that does that, then you can connect me to that.
Absolutely, I'll check it out. And you make a lot of good points looking at testing people, like the biocompatibility of materials here. And recently I had an experience in my practice where, as a prosthodontist, I use, crown and bridge temporary material all day, every day, whether it's bisacrylics or polymethyl methacrylate. And a patient said they had been tested by their physician that the polymethyl methacrylate in dental temporaries was irritating her soft tissues. And I was like, man, that's a problem for me because that's one of my go-to materials. And so I had to talk to my laboratory about alternatives, and we were able to get her some temp material from Peak, PEEK, I believe. I forget exactly what it stands for, but it's a methacrylate alternative, and was not as aesthetically pleasing as what I'm used to using, but luckily it was in the back of the mouth, and it didn't elicit any of her negative skin reactions. But yeah, it's great that you mentioned that, because there are, different workarounds that we have to do sometimes to accommodate people's health, to keep them safe.
Yeah. And kind of like regard, I had a patient that had a crown in her front tooth forever, had it replaced multiple times because it never just felt right, and it came down, well, let's do a material test. Let's see what you're compatible with. And it turns out the cement that was being used, she was tested not compatible to.
Wow.
And so I don't know how many times she had to replace, but here I am replacing it for fourth or fifth or sixth time, and we use a different cement, and she's been great, right?
I'd love to know
So
what ingredient that was causing those problems.
yeah, I'd have to look into it. I'm not sure, but it was a while ago. But there's things like that that pop up all the time where it's just, not everyone, we can't treat everyone like they're the same because everyone's different. And so it's the smallest little thing that could make a difference for a patient, whether they're having gum sensitivity or whatnot, right? And it's on the same note if we're using people that have different heavy metal toxicity loads or immune system tolerances, and maybe the root canal is just tipping it over the top. Everyone's different. So I like to say, to explain all those, well, it's a lot like an allergy. So if you have an allergen and your immune system can't tolerate anymore, then you're going to get a response to it. But some people seem to be okay and not respond to it, right?
That's a great point. I'm curious. So your patients who you see there's obvious signs of chronic systemic disease or negative sequelae, do you also see links to their mouth? Like you can say this person who has these types of systemic symptoms, oh, like, yeah, their mouth probably looks like this. Do you see links between your systemically, chronically ill patients and their mouth versus healthy type folks, or what do you see in your patient population?
Yeah, that's kind of a broad topic because there's so many things that can impact it. But let's say your hormone levels are off and imbalanced, then that's going to have a direct link to inflamed and red and bleeding gums. Often we see that a lot in pregnancy or breastfeeding moms, or see that even when moms or women are going through menopause and they have imbalances. So that's one example of a direct link. People that have typically cardiovascular problems, you can find similar bacteria in their microbiome in their mouth that is a direct link to problems there. One of the most common things we see is mouth breathing, and how mouth breathing, a lot of us have some sort of mouth breathing, but that has a drastic impact on our body, for one, because if we're mouth breathing, we're basically depriving ourselves of oxygen. So we have less oxygen in the brain and the muscles and the tissues of the body. But when we're also mouth breathing, we're drying out our mouth. So that's creating a lack of saliva, and we need that saliva to maintain homeostasis in the mouth. And when we have a dry mouth, our microbiome is going to be way out of whack. We're going to be more cavity prone, and that's actually so it could be mouth breathing, but also medicines can have a side effect of dry mouth. But I've never seen a mouth break down faster than someone that's battling dry mouth. So I could see them 6 months beginning of 6 months, great, no cavities, looks awesome.
Yeah.
And then over the 6 months, they started developing some condition or started taking medicine, and it's like, what happened? Like you have cavities everywhere, and like things, it doesn't just change this fast for no reason. And so that's where we're doing a disservice if we're just okay, we'll fix it, and that's all we do. We're doing a disservice to the patient. So getting to the root cause, okay, are you having sleep apnea concerns? I just had a patient recently. He's like, you know what? Like I never thought about it, but I just started using a CPAP. And I was like, well, okay, does it cover your nose? Does it cover your mouth? He's like, well, it just covers my nose, but my mouth just hangs open. And my mouth's
Wow.
constantly dry. And well, that's that's it, you know.
Yeah. Bingo.
Hopefully we get to the root cause of correct sleep apnea and get things better so you don't need it. But if you do need it, then let's get that mouth closed. And maybe even just a simple piece of tape can help you keep your mouth closed so you're just not wrecking your teeth, even though you need the benefits of all the oxygen. So they're kind of the catch-22 situation. But if we're getting improvements on the sleep apnea side of things as well, then that's going to reap rewards all around. So that's, I don't know if that answers your question, but that's kind of how we approach things, and quickly how you can see it, the mouth is related to the rest of the body.
Is a great point. And one thing that really resonates with me there is the comment on dry mouth. I mean, down here in South Florida, it's known a lot of old people down here. They're on a ton of prescription meds, and one of the common side effects of prescription medications is xerostomia or dry mouth. And most people are just not educated on what the deleterious effects of that can have on your mouth and your oral microbiome, and the prevalence for decay, because without the protective barrier of saliva, yeah, you're at an elevated risk for decay. Even people that I'm just kind of keeping up with their hygiene that have previous full mouth rehabilitations, they think, doc, I got crowns everywhere. What's the big deal? It's like, well, you can still get decayed down by the gum line, kind of where the margin interacts with the restoration there. That site is still susceptible for recurrent decay. And so really making sure they understand the benefits of keeping your mouth moist and trying to promote healthy saliva, and seeing if there's maybe an alternative to some of the prescription meds you're on. So that's a great point that just really encourages people to,
Yeah,
they should be breathing through their nose, keeping your mouth closed when possible, and
yeah.
just really trying to keep a
Well,
moist environment in your mouth.
on that tune, we see a lot of kids in our practice that we try to catch that trend at an early age. So if they're not having their tongue in the right position on the roof of their mouth and their lips closed, breathing through our nose, then their jaw is going to develop in a way where they're more narrow. Their jaw sets backwards, it closes their airway, and it's just going to trigger all these problems down the road when they're older. So we try to catch it when they're young. They'll say, well, let's get things expanded. Let's train you with myofunctional therapy, which is physiotherapy for the mouth, really, for the jaw. Let's get your muscles trained. Let's get your tongue in the right spot, and create a foundation where sure, you're gonna have straighter teeth and more natural smile after that. Have room for all your teeth, but more importantly, we're gonna open back your airway, get you out of the habits that are creating these poor structure developments. And so that's again getting back to the root cause. It's all the way as early as fresh out of the womb where you're breastfeeding.
It's a great point. Yeah, got a good nuggets of information there. And also looking at the diabetes population. I mean, there's research to indicate that periodontal disease and diabetes have a bidirectional relationship between each other, where if you have uncontrolled HA1C levels, that can exacerbate periodontal breakdown, and likewise, if you've got untreated periodontal disease, that can exacerbate your blood sugar levels. So it really is interesting to see how, as dentists, we're on the front lines of not only affecting someone's oral health, but again, just total overall body health. We don't need this compartmentalized view of, I'm only in charge of the mouth and you're only in charge of the foot. It's like, no, we have a whole body to help maintain. And yes, we're knowledgeable on the mouth, but like you said, it's the gateway to the rest of the body. Nutrition and digestion starts in the mouth, and we just have a wonderful launch pad to intervene when needed.
Yeah. Diabetes is a tricky one because to help regulate the blood sugar levels, often people need to eat frequently. And that's where it gets tricky to our mouth because if we're eating too frequently, then our mouth can't catch up. It can't heal, it can't repair itself. And it's just, you're dropping the pH lower and you're going to have constant breakdown. So that's a tricky one too, because, theoretically you need about 2 hours between eating for your mouth to recover. So that's a hard battle, but still can one with the right help, right doctors on your team, you can create a strategy and let's work together to maintain so we're not having all this breakdown from diabetes as well in the mouth, but also maintaining it systemically.
That's a
So
great point.
you're right. We need to build that relationship better in the medical side of things so that we can have more collaboration.
Absolutely. And for folks that are looking to transition into a more holistically minded practice and oral health care environment, what advice do you have for parents and patients looking to make some of these changes?
Um, well, the resources are out there. The place to probably start the easiest is, I think we both belong to the association, the IAOMT, so International Academy of Oral Medicine and Toxicology. They have a great link where you can find a doctor in your area. Um, but, I think the first and foremost is to ask questions to the doctor, the dentist you're seeing currently. See what their thoughts are. A big part of your healthcare relationship is trust and communication with your provider. And if you feel like you have a great relationship with the doctor you're seeing currently, then start posing some of these questions. And if you're not finding that it drives well, then the IAOMT is a great source. There's lots of doctors and companies like Risewell that are very present on Instagram. I know a lot of people find us through Instagram. Just Googling in the area, holistic doctor or natural dentist around me, I can find a lot of sources. But I think the IAOMT is a great place to start.
That's great advice. And some of the things you said made me think of there's another systemic link I was actually encountering in my office recently, where the advent of these Ozempics and Mounjaros and the GLP-1 agonists looking to help people suppress appetite, lose weight. Yes, when you're morbidly obese, that trade-off is probably fantastic because being that overweight is not a great systemic condition for you. But in addition to losing fat, research is suggesting people are losing muscle mass and bone mass too, potentially creating a population of osteoporotic or osteopenic patients. And when those patients, then they get put on another class of medications like the Prolia and the Boniva type bone density medications, where it inhibits the osteoclasts from doing its job. That is the bone breakdown molecule. And unfortunately, those folks have a hard time with the dental sequelae of getting dental implants or dental extractions, because when you're on those medications, it really, for whatever reason, manifests in your jaw bones where the jaws don't heal properly after surgery. So you're really in a pickle as to when treatment would be best for you. If you need an extraction or need a dental implant, you really need to make sure the dentist and the rheumatologist are on the same page, looking at how to stage these medications and when to cycle them and when it's a safe period to do some of these dental procedures here. So that was another manifestation I've been seeing
That's
down here in South Florida.
that's that's interesting. It makes total sense. We haven't Ozempic isn't popular up here in Canada, at least yet.
Yeah.
So I actually never seen a patient that is taking Ozempic.
Okay.
Um, but that makes sense. Have you so like bisphosphonate medication? Is there more links to osteonecrosis of the jaw?
If you're not careful, yeah. If you don't stage treatment appropriately, yeah, you got to be super careful of when extractions happen. And if I have some surgeons that won't touch a patient if they're on them. Some are a little bit more aggressive in their philosophy and are able to find periods when after 6 months the medication dips down to a safe enough level. But I think we're really kind of still at the precipice and in the infancy of learning how to work with this patient population and what these medications do to your overall health and your oral health.
Yeah.
So just something to be aware of.
Yeah, that's gonna now resonate when I see that first patient come in. Oh yeah, doc, I'm taking Ozempic. Okay, well, there's as if there's not enough concerns with it, anyways,
Oh
right?
yeah, oh yeah. Well, Doc, I want to be respectful of your time here, and I'm curious as we kind of conclude, any other topics you want to discuss? I mean, what other lifestyle hacks or oral health hacks do you have for folks out there?
Well, no, this has been great. I've been happy to talk and enlightening to me. It's been awesome, and I know hopefully some of my clients will tune in and hear it. Will this be a repost or anything on Instagram itself, or
Yeah,
share
we'll give
snippets?
you, yeah, we'll give you editorial access to share the content with your folks and help promote it
Yeah,
and get the message out there for
yeah.
sure.
So that'll be good to hear about the nano. But the kind of the tips I give parents, and I often say to moms so that bring in their kids, that they're like, why do I get cavities all the time? And we feel like we do everything right. We eat right, we brush, we're doing good. That the two main things that are overlooked are you mouth breathing and how often are you snacking and eating? So we phrase it as a 2-hour rule. If we follow the 2-hour rule where we eat our food, you know, drink our fluids, whatever it is, and then we let our saliva kick in and buffer things out and start to bring the good minerals and everything back to the teeth. That's about a 2-hour process. So if we follow that rule in general and spread out how much we eat, that's going to have a big impact on our microbiome and not getting cavities. So that's one thing I find that's not preached enough in the dental world that will have I think the biggest impact. So that's kind of my quick tips and it's like I said, like a lot of we're talking about. It's funny how many people say I've never heard that before. It's like, oh, and they don't even really teach you that very well in dental school, so it's not surprising. But hopefully it becomes more and more well known.
Absolutely. Well, again, as we wrap up here, we always like to do a live Q&A session from our folks out there watching and listening. And my team was able to compile some of the questions out there. And I'll start with you. I don't know if they're directed to me or you specifically, but in general, question one, can you or myself discuss the connection between oral pH and health of the oral microbiome? Any thoughts on that?
Uh, um, I'm guessing that's alluding to oral pH and the pH of the rest of the body.
Yeah, I don't know. I'm just rehashing the question here,
Yeah.
but again, I would just kind of say that yeah, I mean, as your pH dips in the mouth, and you get more in the acidic range. You're promoting a more demineralizing environment for the teeth, losing minerals. And in terms of the microbiome, well, Strep mutans, that's the bacteria part of the microbiome that is responsible for creating the acids that leads to that dip in pH here. So
Yeah.
that's one of the links I can think of here. Not exactly a pH expert myself here, but
I,
yeah, that's something
I,
we'll be
I
talking about.
agree. And I'd further it to the rest of the body. So if we're having low pH in the blood or the rest of the body, that's where I say, hey, maybe you need to go check this out with your naturopath or your functional med doctor. But if you're having recurrent, as there are episodes where you're having recurrent reflux or vomiting, which has a direct connection to the oral mouth, obviously. But as we talked about earlier, mouth breathing. So that's going to directly decrease your pH
Absolutely.
when you decrease your saliva. So again, yeah, the mouth and the oral microbiome pH, 100% connected, and even further the rest of the system of the body.
Yeah, and it's such a slight narrow range of health before you get dysbiosis and dysregulation here.
Mm-hmm.
Question two, can we explain the process by which hydroxyapatite remineralizes teeth? So I'll just try and take a stab at that quickly here. So again, hydroxyapatite it's naturally occurring. It's what your teeth are already made out of, the calcium and phosphate molecules here. And so when you're in a acidic, low pH environment, the tooth starts to lose minerals, lose the calcium and phosphates leaching out of the tooth here. So you need a reservoir to refill in the minerals of the calcium and phosphate. That's where exogenous hydroxyapatite, such as a toothpaste, comes in, because it's able to serve not only as the way to fill in essentially the chips in the armor. So the hydroxyapatite, they're the positive charge of the calcium and the negative charge of the phosphate in the toothpaste is attracted to the hydroxyapatite that your teeth are already made out of. It has a natural binding affinity to those molecules, and so is able to bind to the enamel there and create a similar hydroxyapatite substance and similar hardness and crystal and lattice structure to your natural endogenous hydroxyapatite. And also, the toothpaste serves as the reservoir. Once that's in your saliva, you need that reservoir of the calcium and phosphate molecules to help fill in the chips in the armor. And that's one of the arguments against fluoride, because with fluoride, if you're using that as your main remineralizer, you still need, it's relying on your reservoir of saliva for calcium and phosphate. Well, we already discussed that a lot of folks have xerostomia and dry mouth, so you don't have a reservoir of saliva from which to get your calcium and phosphate. So those folks probably better candidates for hydroxyapatite because they don't have the saliva with the free-flowing calcium and phosphate reservoir to act.
And I like to, on top of that, the saliva is basically the golden elixir of the body. And when you add hydroxyapatite to it, it's supercharging the saliva. And if you, correct me if I'm wrong on this, Derek, but if you compare to fluoride, for example, hydroxyapatite has effects that penetrate deep into the tooth, where fluoride's more superficial, if any benefit at all, right?
Yeah, it's a great point. Yeah, the research has shown that hydroxyapatite nanocrystals are able to penetrate deeper into the subsurface lesions, and the fluoride is more of a superficial effect, hardening effect.
Mm-hmm. I like to encourage patients to, when they brush their teeth at night, not to rinse, just to leave, even take their finger and just rub it around the teeth, especially sensitive areas, and just leave it.
Love it. Yeah, that or making bleaching trays and filling that with hydroxyapatite dentifrice to help get some overnight, increase your contact time for rampant decay type folks. Question 3: what is the safest way to whiten your teeth without damaging enamel?
That's a good question, because all the peroxides out there do damage the enamel. I think you gotta just do it with caution. Whether you use charcoal, whether you use whitening strips, whitening trays, you just got to be careful and cautious. If you start to notice sensitivity, you got to stop. The best way, really, honestly, I think using hydroxyapatite toothpaste is going to give you a whitening effect.
Yeah, I mean, look for light extrinsic staining. Yeah, just surface roughening, hydroxyapatite, trying to minimize your exposure to all the fun stuff like coffee, tea, and red wine. Unfortunately, is going to help keep your teeth nice and bright. Unfortunately, for intrinsic, deeper staining, using the chemicals is the best way to do that. But it's a trade-off of getting efficacy versus using chemicals. So it is a trade-off. You got to see what you value.
Mm-hmm.
Next question. This person is asking, just to clarify, Risewell Pro has nano and the regular line has micro. Yes, the traditional line has micro hydroxyapatite and the professional line has nano and micro hydroxyapatite. Number 5, if you can give just one piece of advice to help people improve their oral health today, what would it be?
The last tip I gave, that 2-hour rule, if you can follow that, then that's going to help you the most.
I love it. And last question, Doc, there is a lot of discussion about the oral microbiome and its role in preventing cavities, gum disease, and even chronic illness. What should people be doing daily to support the healthy oral microbiome?
Well, if our body's lacking anything, supplements, key supplements to use, I would say hydroxyapatite being one of them, vitamin D3, vitamin K2, great for bringing calcium to the teeth, to the bones. Eliminating mouth breathing, following the 2-hour rule. Those are the best ways to address it. So if you want to boost your microbiome, in our office we use ozonated water when we clean teeth.
Okay.
And so that's a natural way to disrupt the microbiome, but it kind of gives you a clean slate. So you got to rebuild. So things to do, you can add probiotics, prebiotics. I think Risewell has some products in that regard, do they not?
We don't have a specific microbiome product yet where we're in developments, but essentially my advice would be to avoid alcoholic mouth rinses. I think
Yeah.
there maybe was a philosophy at some point of all bacteria bad, must kill everything, scorched earth at all costs, and just douse everything with alcohol. And yes, that was killing bacteria, but it was also disrupting the heck out of your naturally occurring oral microbiome. And it's funny, I was recently at the IOMT in Salt Lake City, and one of the vendors there had a microscope where you get to look at the bacteria of your gums under the microscope, and it's kind of ekes people out at first, but then you realize that, oh, wait a minute, like the healthy microbiome, like that's what it is. It's bacteria. It's supposed to be there. We live in this commensal relationship between human cells and bacterial cells in this beautiful arrangement where we get along and help promote health. And health is such a narrow window. You don't want to be disrupting that by killing everything with alcoholic mouth rinses. So my advice is avoid alcoholic mouth rinses and use ours, which is sodium bicarbonate and xylitol to promote health.
Oh, even beyond that, we just made a post this week or something about the mouth is not meant to be sterilized. So whether it's ozone, whether it's alcohol mouthwash, or even natural things like coconut oil or essential oils, those still can disrupt your microbiome. So we need to be cognitive of that and use them with caution. I agree with you. Alcohol mouthwashes, absolutely no. But we can do things. We take prebiotics. I would say if it's not directly in your mouth, break open the capsule, pour the powder in, swish it around, probiotics, that sort of thing to just help maintain it.
I love it. So Doc, again, thank you for your time today. And again, where can my community help support you and find you and your future projects and endeavors?
Yeah, well, the name of our office is Living Wellness Dental. We're up in Calgary. There's not a lot of us like us in this area. Even in Canada, we have people all over Canada coming to our office. And so you can find us livingwellnessdental.com. You can find us on Instagram here, Living Wellness Dental. Of course, if you're in the area, we'd love to see you. Or even if you want to travel, you're welcome to come see us as well. We're happy to be on the journey with you.
I love it. And Doc, if you ever find yourself in South Florida, please come visit here in Boca Raton. And for all our Canadian friends up there, we have some exciting news at Risewell. We're now able to offer Risewell products to Canadians. If you want to visit pro@risewellpro.com. We have ordering information for Canadian providers to finally get their hands on Risewell.
Okay, so that means you can ship to Canada, huh?
Yeah.
Okay, so must have been all the pestering that I've sent. Why can't you guys ship to me? Because I've had to bring it up. I've had to ship it to the States and be like, okay, I'll haul it up.
I know your prayers were answered, but thank you again, Doc, and awesome. Appreciate your time today.
Okay, you too. Have a great day, and we'll catch up again.
Take care.
All right, bye.